Do you have recurrent miscarriage? And are you thinking of using progesterone? Let's talk about it. I'm Dr. Anil Kodi from Fertility Plus London, and today we'll talk about two trials which may show whether taking progesterone may help in lowering the risk of recurrent miscarriage. Which are these two trials? These were conducted in the UK and indicated that in cases of recurrent miscarriage, they may be helpful. The first trial was the PRISM trial, and the PRISM trial was a progesterone in spontaneous miscarriage. And this was a large trial which was randomized, double blinded, so it is a much better trial, involving 4,153 women from 48 hospitals in the UK. And what were the key findings? The key findings were that progesterone treatment did not increase the live birth compared to the placebo. It is 25%, 75% to 72%. But however, a subgroup analysis of this entire study found that giving progesterone was beneficial for women with one or more miscarriages and current pregnancy bleeding. So if you had 1 to 2 previous miscarriages, there was a 75% live birth rate with progesterone compared to 72% with placebo. 3 or more miscarriages, 72% live birth rate compared with progesterone compared to 57%. So for women with 3 or more miscarriages, progesterone reduced the miscarriage rate to 23% versus 36% with placebo. The second trial was the PROMISE trial, which was progesterone recurrent miscarriage, studied 836 women with unexplained recurrent miscarriages from 36 hospitals in the UK and 9 hospitals in Netherlands. And it included 3 or more consecutive or non-consecutive miscarriages and trying to conceive naturally. Women received 400 milligram of micronized progesterone twice daily and no later than 6 weeks until 12 weeks of gestation. And the primary outcome was the live birth rate beyond 24 weeks. So, what do these studies indicate and their recommendations? Based on these trials, mainly on the PRISM trial, which has a large number of patients, the National Institute of Clinical Excellence now recommends progesterone treatment for women with vaginal bleeding in early pregnancy with at least one previous miscarriage. The recommendation is, how much progesterone do you give? 400 milligram of micronized progesterone twice daily vaginally till 16 weeks of pregnancy if the heartbeat has been confirmed. Progesterone is not recommended for women with vaginal bleeding in pregnancy with no previous miscarriages or with previous miscarriages with no current bleeding. These trials produce, at present, reasonably strong evidence that progesterone may be beneficial in preventing miscarriages for women with a history of recurrent miscarriages, particularly when combined with early pregnancy bleeding. It's important to realize that, however, it does not appear to be effective for all women with threatened miscarriage and thus should be reviewed. Thank you.